So from that conversation, I remember, then day onwards, he started looking into his blood sugars and getting his blood sugars regularly for every follow up. And within 3 months' time, we could bring down his HbA1c by 1 gram. From 9.6, we could get down to 8.6. In another 3 months, we could bring it down to 8.3. Those who have even one reading of HbA1c crossing 5.6. So you have got 5.8, 5.9 HbA1c, take it seriously, start working on your lifestyle right away. The morbidity, the diabetes, is a very morbid disease. It is a burden, a health burden to society, an economic burden to society. The healthcare spending at individual levels and at the level of the country is massive. He went into hypoglycemia in just 3 days of treatment and 3 days of making a change in his diet. And the hypoglycemia lasted. The mainstream medicine, my allopathic colleagues, they will respond to you positively, provided you are willing to document and you are willing to talk science. Instead of talking about uh, uh, a one-sided view of the disease phenomena in front of you.
So, welcome, dear all, to another episode of Homeopathy Vartalab. Today's episode is special. In a way, every episode is special, but today's is especially so because we have with us a very senior doctor who practices both in Ahmedabad and Mumbai. He is both Indian as well as international patient, and he has created a niche around treating patients with diabetes, with homeopathy, with diet, and lot many other things. Now, what is that is today what we are going to discuss with Professor Dr. Munjal Thakar.
Hello.
Sir, welcome to Homeopathy Vartalab.
Thank you.
So before we begin, like we say that unless we understand history, we will not be able to proceed. So what brings you to developing a niche into treating patients with diabetes?
So, first is my personal own story and a history, and the number of patients that one encounters in practice with diabetes is massive. And we all know that India is a diabetes capital, especially Gujarat and Ahmedabad. So many patients with diabetes. And not only the quantum of patients, but the morbidity. The diabetes is a very morbid disease. It is a burden, a health burden to society, an economic burden to society. The healthcare spending at individual levels and at the level of the country is massive when we talk of diabetes. And it is a disease which is very preventable. It is a disease that has a big scope for reversal. And the kind of morbidity that we face, I thought so, and my experience in the early days before I could develop some very more sharper ways of dealing with it, is homeopathy can help. Till I could work through and see how specifically homeopathy is helping. So this was sufficient, drive to do some very focused work with this illness.
That's quite interesting, sir. That when you said you developed a certain focus, and then you also realized that there are certain limitations in
Yes.
one way or the other in different types of therapeutics, that you also decided to take up other modalities with you in treating diabetes.
Yes. So as I understand medicine, I see that the current day challenges that we face in terms of health crisis, there is no one system of medicine that is going to be complete. We are going to have a complete 360-degree integrated approach where we use the strengths of each system come together and deliver a better healthcare to society. So, diabetes is an integrated care. It is not pure homeopathy, or it's not pure mainstream medicine, or it's not just pure diet. We are working on an integrated model.
So, sir, does that mean that you are working with an allopathic doctor as well?
Yes, yes, that's true. So, uh, what is important is that one will need to have collaborations at multiple levels. Collaborations with mainstream endocrinologists, diabetologists, or even internal medicine doctors who are working with their patients. And some basic understanding of conventional medicine, how it works with diabetes,
Hmm.
the drugs that they use, insulins that they use. While I do not tend to interfere with those drugs personally, I would collaborate with the diabetologist or the endocrinologist who is treating the patient, constantly take their feedback, you know, and then work with my patient. But that knowledge of what their medicines is doing is very, very important. For example, my own uncle who came to me several years back with diabetes, when we started homeopathic medicines and he was willing to make a change and shift in his lifestyle, we found that he went into hypoglycemia in just 3 days of treatment and 3 days of making a change in his diet. And the hypoglycemia lasted. Now, at this stage, if I were not aware of what medicines he's taking, what conventional medicines he's taking, I would be at sea of what is happening to him. So, my knowledge of the conventional medicine drugs, what is classically called as sulfonylureas, they have the potential to produce a sustained level of hypoglycemia, and which is a very dangerous phenomenon. This knowledge helped me tide over this critical period, gaining confidence of my own family members and the insight into how long this hypoglycemia will last, what corrective measures need to be taken. This is what you will need, along with, of course, your own expertise of homeopathic therapy and the understanding of the basics of diet, nutrition is equally critical. So one will need to have this 360-degree view to tackle this disease.
Hmm. So again, another interesting aspect that I notice and noteworthy is that the knowledge of allopathic medicine is something that you have also
Yes,
gathered over a period of time.
yes. So I think most of us would go back to our medical school days where diabetes, even at undergraduate level, is taught. The basic drugs are always been a part of your understanding of your consciousness. But what is important is, especially when I was in medical school, it's almost 35 years, 30 years now, a lot of advances have been made. When I was in medical school, there were only two drugs. One was metformin and others were sulfonylureas,
Hmm.
two set of drugs. But now we have a plentiful of drugs to manage. Insulins were changed a lot. So one will have to keep pace with that changes in knowing it.
Hmm.
And I do not like, once again, I will reiterate, and for colleagues who wish to embark on this journey, the knowledge of what is happening in this pharmacology, modern pharmacology, is important. Yet you may not tinker around with these drugs because it's not your specialty. You leave it to the specialist to take care of it, but you understand what is the change he's making, how it is going to influence uh, your understanding of the patient's follow-up after your medications. What changes do you need to make for yourself? How are you going to adapt with those changes? Because understanding diabetes for a homeopath, especially after you have initiated the treatment, after you have made the prescription, is often like shooting a moving target because the baseline keeps changing, especially in patients who are what we call brittle diabetics, where the blood sugars are very highly fluctuating. So, in collaboration with the mainstream medicine doctors, you will find they will keep making changes in the drugs very quickly. So, if you do not have the understanding of what these drugs are doing, you will fail to interpret what the patient is going through, how the sugars in the patient are also shifting along under the influence of those changes. And then in that gap, what your medicine is doing. If you do not realize that, you are at sea of what you are going to do next with your patient.
So basically, this is a deep dive into the subject rather
Yes.
than we may. The reason I talked about allopathic medicine is to
Yes.
be very frank that there is a lot of controversy happening between the homeopathic lobby and the allopathic lobby about cross-pathy practices, and at the same time, there is also a feeling that if I am a homeopath, why do I need to study or understand allopathy? That is not my job.
Right. So, I mean, let's not uh, become a cult. You know? For me, I'm first a scientist, then a physician, then a homeopath. So, from the vantage point of a scientist, I'm going to examine every phenomena that is there in front of me objectively and critically. As a physician, I'm going to put my patient's well-being before my own system, and then integrate all these inputs into what therapy I am specialized into. So, instead of being loggerheads with each other, I also find that my allopathic colleagues are becoming more and more collaborative rather than being at loggerheads. What I have found, especially for my dear young homeopaths who are coming up and going to listen to this podcast, uh, the scientific community at large and the mainstream medicine, my allopathic colleagues, they will respond to you positively, provided you are willing to document and you are willing to talk science instead of talking about uh, uh, a one-sided view of the disease phenomena in front of you. This I am not limiting myself to just diabetes. I'm taking this forward to practically every disease that you face. And in the current generation of homeopaths, because the so much spade work is being done by our seniors, that very early on in your career you are going to come across serious pathologies. Patients now opt for homeopathy much earlier than what it used to be when I started my practice. So you will have to gear up, to take up these challenges. And it's more fun for you to collaborate with your allopathic brethren, with your allopathic colleagues. And they find also very interesting when you give a feedback as to what you are able to do, and the patient goes also and gives them the feedback as to what we have been able to deliver when we come into the loop of practice. So I think we need to get out of this idea, this divide, that you are an allopath or you are an Ayurvedic physician and I am a homeopath. We need to dissolve these identities. Yet we are centered within our expertise of what it is, and at the same time appreciate recognize and harness the expertise of the other. This together, we will probably bring better healthcare, more better quality of life to our patients, and I believe that I will sleep better if I do this.
I remember one of the first videos that I had watched of yours was about communicating in the right way. I remember one of the excerpt. Let me see if I can link this video. Then that
Okay.
is something that we can take. This topic will be useful over there. So, sir, coming back to diabetes, what is exactly happening currently? Because we are seeing a range of HbA1cs going above 6 or at least 6 in patients as young as teenagers.
Yes,
What we used to earlier is, if you recall my own grandfather, maybe he must have developed hyperglycemia in the age of 60 or 70.
exactly.
After that, he lived a long life till 100 years.
Yes.
So, why is this happening and how do we deal with this?
So I think things are quite obvious. The change in the lifestyle, and what do we understand by lifestyle? I mean, that's the fundamental question. The lifestyle is the food choices that we make, the activity choices that we make, is what constitutes our lifestyle. And what is made available. Now, what is made available to us is fundamentally a reflection of our own choice. Our own choice as a community, as a race. So, what is going to be made available to you will depend on each one of us making a contribution. So, let me tell you from my own example. Almost 18 years back, 2006 or 2007 or around that time, I made a change in my food choice and I shifted to what is called as a whole food plant based diet. In those days when I started, it was hard for me to get plant based foods. Hmm? But today, almost 20 years now, 18 years, the amount of options of plant based foods available in the restaurants, in cafes, is big. So, why did this happen? Because there were individuals like me and my family who went to the cafes, asked for the food that we wanted. You know, I give you this classic example of the Jain community.
Mm-hmm.
They all decide or they follow or they believe that they cannot have onions and potatoes or garlic, and you will find Jain food available across the board, across the globe, because the community demanded. So we have to create that demand, and I believe that's happening. So we are getting healthier options also. At the same time, a larger awareness is happening in society through various mediums of what is unhealthy. So we are now having food choices, better food choices to make, better nutrition choices to make. Yet there is also the other side of our consumer economy. The whole idea of consumer economy or capitalist economy, if you understand, is to consume, right? We consume everything. We consume media, we consume news, we consume food, we consume clothes. So that's the other side also, where so much consumption is happening at in the teenagers at school levels, that a lot of refined food goes in, lot of oil goes in, lot of dairy products, refined dairy products also go in. Lot of processing is happening at the food level. That is, and because now we are a affluent society, the physical strain, for example, from reaching from one place to another is now an ease. You take up a car or a vehicle which would take you there. So this is one of the reasons why there is a spike. Uh, so this is what I call the environmental reason, but there is an inner environment, what we call our genetic susceptibility. For example, my generation, the genetic load or the genetic susceptibility to diabetes, say for example, if I were to quantify, it cannot be really quantified, but the genetic susceptibility to diabetes in my generation was little less than the genetic susceptibility of the current generation. For example, in the current generation, you can easily have 3 generations of their forefathers already having diabetes on both sides of the family. Whereas if I look at my own family history, I wouldn't find 3 generations. I might at the best find 1 generation on one side of the family. Today, a child might have both sides, the maternal and paternal sides, at least 2 generations or maybe even 3 generations of diabetes or any other metabolic problems. So both kind of make you more vulnerable to develop uncontrolled or a failed glucose carbohydrate metabolism, give you hyperglycemia at a very early age, which is of course a concerning trend.
So, sir, two things I've understood is one is the type of food. Three things. Second is the lifestyle. Third is genetics.
Yes.
Genetic load.
Yes.
Sir, what about like I have reason I'm trying to bust this myth is because so many reels are going on Instagram that the major reason for a glucose spike or having high cortisol level, which leads to glucose spike, is stress, lack of sleep.
Yes.
Is it that important compared to the other three factors?
See, again, so what is stress? I mean, what is stressful to you is not stressful to me. What is stressful to me may not be stressful to you. So, I specifically didn't mention this issue is because it's a very individual perspective. So, I mean, each generation had a different kind of challenge, So, every generation has a stress. Without stress, there is no life.
True.
The only idea is how you work with that challenge. I would like to call it challenge rather than stress. So it's a very individual way of looking at things. Therefore, stress is a very individual factor. I'm not sure if I would be right in saying that this generation is very stressed and 2 generations from the current generation were not so stressed. We had a different stress. I mean, imagine when my mom and dad would tell me that when we were children, we didn't have an electric bulb and we studied under lanterns or street lights. Now, if I were to imagine this to me, if I were to grow up in that situation, it's hugely stressful for me, right? Now, when I tell my children that for me an air conditioner was a luxury when I was a young boy studying in school or going to coaching classes, for them it's a huge stress that how can you survive without an air conditioner? It's become necessary. Or same thing with cars, vehicles. So what is stress is highly individual. At the same time, each community has its own factors which are going to be stressed, and each community also has, each generation probably has their own vulnerabilities also and their own strengths to take care of that stress. So hence I didn't make a mention of this as a generic factor, but yes, diabetes is deeply related to stress, very deeply related to stress, which is, I would consider, a very individual phenomena.
So I guess, sir, that is where homeopathy would come in, or maybe a psychological counseling would probably be more.
Well, yes. So because homeopathy, being a holistic system of medicine, will consider so much of the patient's mental makeup and the stress that the patient goes through, how the patient handles each stresses is considered in a very detailed manner, along with, of course, the physical suffering, which gives that classical niche of homeopathy. So a lot of patients who are very stressed out and they are on conventional medicine drugs and still the diabetes doesn't get controlled, introduction of homeopathic medicines to this over a period of time helps them achieve a better control because they start de-stressing.
So now that we have holistically understood the causation of diabetes vis-a-vis food, lifestyle, stress, etc., when we talk about treating diabetics, patients who are having diabetes, what would be an ideal approach? Or let me put it this way: if I'm a patient who has diabetes, what should I be doing once I find out that I have diabetes, or is there anything for me to prevent? One is that if I can prevent. Second thing is, what should I do after I get diabetes?
Right. So, first and foremost, uh, a large part of diabetes is detected on routine examination of the blood. Especially when it comes to children who are getting diabetes, young, I mean, children means adolescents who develop type 2 diabetes. Usually, a type 1 diabetes is normally diagnosed at a catastrophic event, where they would be hospitalized, become seriously ill, lose their weight, and then it's kind of picked up because. But when you're talking about type 2 diabetes, which is uh, much more subtler, you will pick it up on your routine blood reports. So often I find that if your HbA1c starts going something like 5.9, 5.8, you are already on the borderline, what we call as impaired glucose tolerance. Now, this is the point where you do not wait for your blood sugars to get into the diabetic range. The moment you develop uh, impaired glucose tolerance, your pancreatic function is compromised significantly. So, this is the time where you start making changes in your lifestyle, in the food choices that you make, in the activity levels that you do, because at this stage, your metabolism, when you make a change in the food, in your activities, it brings about a change in your metabolism. This new metabolism creates in the body what is called as metabolic memory. Now, this memory is like the memory of your weight. Our body has, our tissues have weight memory. There is a set point. Your metabolism is set at a particular level, like your temperature. It's set at a particular level. Even half a degree above it, temperature, you are able to sense it, right? Similarly, with your weight, you will figure out. If your weight goes a kilo up or 2 kilos up, you will sense it even before you're standing on the weighing scale. So there is a metabolic memory which is guiding our existence all the time. And this metabolic memory, creating a correct metabolic memory through a appropriate change in your food and in your activity, is going to be your anchor for future management of diabetes. If you create a healthy metabolic memory, your body will tend to come back to that health level. So if I were to give you an example, for example, a chronic disease like diabetes constantly keeps progressing. So it's like you've already shot a bullet and it's going to go through that trajectory. Similarly, our health also has an inertia. It continues to remain healthy, provided you have made that effort. So each time you eat the right food, remember you are contributing every day to create a new, fresh, healthy metabolic memory. This memory will serve you to come back to normality. As much as the disease has the ability to pull you to become more disease, health has the ability to pull you to become more healthy. So make that effort to create the healthy metabolic memory. That's very, very important. And that will help you for long years to come.
Sir, if I may just ask from my own context. So, for example, if I am going to a wedding, I am having all types of foods that I love eating for 2 days, 3 days, and fourth day onwards, my mind and body tells me, okay, today you are only going to have soup and maybe some khichdi or something like that. And I do that for 3, 4 days, and my stomach gets absolutely fine. I even lose about half a kg, 1 kg weight, and eventually, as I resume my normal diet, I start losing more weight. I come back to my baseline. Sir, is that a right example of metabolic memory?
Uh, the idea that we all have a metabolic memory, right? Regardless of what is the level of health within that metabolic memory is varying depending on the way you eat, the way you exercise, right? So you will always want to come back to your that natural level. For example, you said 3 days I ate outside, ate everything that your tongue was happy with, and on the fourth day your body tells you, okay, hold, come back.
Mm.
So if you are within the health state, your body will allow you maybe 1 or 2 days of indulgence and come back. So your margin of error goes down.
Okay. So that understanding that okay, enough is enough, that is metabolic.
It's not understanding. It's not very intellectual. It's the feel in the body.
Okay. It's in the gut, probably.
It's in your feel, it's in the whole being, if you understand that. For example, if you lose 2 kilos, where do you feel you have lost 2 kilos? There is no one place that you feel, right?
Correct.
It's the general sense of your own weight that you are experiencing. So, same way, you know what you have eaten today is not feeling good. So that's the memory that I'm talking about. It's the memory of your being.
Oh my God. Which means that if someone does not realize after binge eating that okay,
Yes.
so what? And the person
Yes.
keeps so that metabolic memory is
So there is a metabolic memory. I mean, you don't become 200 kilos, right? You are oscillating at, say, you're 100 kilos. You're oscillating at 100 kilo. Your body still remains at 100. It doesn't want to go to 112.
Mm.
There is a set point. So it'll like a thermostat. It'll come back here.
Right.
You will remain at 100. But somebody who is, if your target weight is supposed to be between 65 and 70, and you are at 69, which is within your health zone, then when the moment you go over 70, your body internally will tell you, hold back, come back, and you go back to 69. This is the margin I'm telling you.
I think now I can relate better.
Yes.
Okay. Now, once someone is diagnosed with diabetes, what would be your individualistic approach? Reason I'm asking is so that we can bring it across to people that okay, this is also an approach and something which can be used to successfully treat. And I've also seen your videos where you have talked about reversal of diabetes.
Yes. So first and foremost is what is the level of the problem? How controlled or uncontrolled is the diabetes? So we see two sides of patients. One set of patient comes as soon as they have a diagnosis, freshly they will come to you. The other set of patients is somebody who is already diagnosed for a few years. They are taking the conventional medicine and now they want to make a change. That is the next set of patients. And the third set of patients is somebody who's chronically diabetic, takes a lot of the allopathic medications. So three categories I can broadly divide into in terms of the severity of the diabetes. Then I look at it as to how motivated the patient is to make a change, because that is the critical factor. While I am willing to show a path, on which you can walk, but eventually you have to walk. I can help you hold your hands and then guide you to be there. So the motivation of the patient is always behind my, in the back of my mind, to check what is the level of motivation. So that is the other thing. The third layer that I look into it is what is the larger causation in this disease. So in patients where I find that they are young and they are indulgent into a lot of food, that is refined food, sugars, and lack of exercise, I would motivate them to make a change. This is in their lifestyle, food choices, activity choices. Young patient, I will not want them to go to the gym and pick up the dumbbells. Maybe you do that once or twice a week, but pick up a sport where you can enjoy, at the same time you're taking care of your weight also, activity level. At the other end, you have old patients who are diabetic. Now here also, more than the drug, you will want to stress on their change in the lifestyle, provided there is enough motivation. So these are two extremes. Someone in between, you will look into what is the emotional stress that you find, especially men who are working, women who have a lot of emotional issues, especially if they are not working in the family. So this stress is where, of course, the blanket is you need to make changes in your lifestyle, but here the homeopathic drug will play a very critical role into these set of patients to help them achieve better glycemic control. So this is how I will approach. And the next layer of looking at this, each patient, is going to be a complete diabetic screening. So at first visit, at least, or very early in my consultations when patients come to me, I will check if this disease has started affecting other vital organs. For example, looking at their kidney functions, getting their eyes checked, checking their feet, getting a basic cardiac checkup if any of these vital organs are getting affected. Because in diabetes, you need to be careful that vital organ affection is very silent. So you have to work with a lot of suspicion. You need to do tests and pick them up early, because the earlier you pick up, the better is the reversal. If you wait for too long for clinical symptoms to appear, you have already into a irreversible phase. So this is how I will, these are parameter layers in which I will look at each case, whether it comes in a young patient or in old age, the whole spectrum.
I would like to understand what is the nature of compliance that comes with diabetics, because what I have noticed is, in the first place, no one likes to be called a diabetic.
Yes.
Number one. Number two, when they start treatment, there is always a sense of judgment that comes along. That, okay, my next blood sugar is going to be high, so everyone is going to reprimand me, or it is going to create someone, or maybe the doctor will get angry on me.
Yeah. So this is something that needs to be learned by the physician himself, by the patient himself. And there are no books so-called available. But what I find, and I can tell you one case where, because I have learned over a period of time communicating with diabetic patients or patients who have high blood sugars. The way you communicate is very critical. Early in my practice, if somebody is not, because I was very over enthusiastic, very passionate to get them better, I would be little annoyed, and that would kind of put off the patient. Sometimes they would come feeling very guilty about it, or they would stop coming, or they feel offended about it. But over a period of time, as I become more and more dispassionate in treating this disease and seeing the whole phenomena objectively, I remember this young boy, 16 years, when he came to me. He was insulin dependent diabetes, and he had stopped bothering about his food, monitoring his blood sugars. He would at the most get his HbA1c done every 3 months because his siblings were doctors and they would tell him get it done. But otherwise, he would just not bother about what he's eating, what he's exercising. And this went on for around 6-8 months, and I couldn't reach him when I would talk to him. And then came a time where I said, young life is getting compromised, where his HbA1c is well above 9 in spite of taking insulin. So at this point of time, I said, let's get talking. And I got him talking as to what his problem was and how I can reach him. This is the question I asked him. How do you think I can reach out to you? And he got his sister, with whom he was very close, and he would listen to what she said. And then we kind of looked into what exactly is happening. Because a lot of these adolescents, when they come with high blood sugars, if they don't get controlled very quickly, they get a lot of frustration. And they kind of just stop doing anything. So from that conversation, I remember, then day onwards, he started looking into his blood sugars and getting his blood sugars regularly for every follow-up. And within 3 months' time, we could bring down his HbA1c by 1 gram. From 9.6, we could get down to 8.6. In another 3 months, we could bring it down to 8.3. So we could make a big shift, when he started managing his blood sugars. And then, of course, he's very regular now. He started bothering about himself. So communicating with diabetic patients is something you have to, what I call deep listening. You have to listen to a lot of cues that these patients are giving. They will not directly tell you what their problem is because probably they are not aware of it. So one will have to explore by giving sufficient time to them and talk to them what really is the factor that is not allowing them to take care of their lifestyle, their own sugars. So you will very often find that they will keep telling you, okay, from next time I'll do it, from next time I'll do it, from next time I'll do it. Or they will keep giving you excuses that these tests are expensive, so I will not do it, I will not do it. And then next time. So when this kind of repeated pattern happens, there are more deeper unconscious issues that is preventing them from looking at their own blood sugars.
Sir, I understand that homeopathy itself as a science requires a lot of interviewing, and there are techniques which we use or employ to bring out what is that in the hidden conflict or the unresolved conflict of the patient.
Yes.
Does it so happen, or rather, would you also recommend taking help of maybe a clinical psychologist to assess the personality, and a therapeutic or a counseling psychologist and an REBT specialist to help the diabetic patient who is not that way compliant, and you figure out that there is some hidden.
Yes, I guess so. This is true from my experience. Also, there is a whole bunch of experts called counselors, diabetic counselors.
Oh, okay.
So they work especially with this area. So yes, integrating them into our practice would actually help them.
Wow. There are many questions which I have, probably related to any specific organ issues, and also the post 2019 thing that happened, whether that has also impacted the way you have been seeing patient. I would not say the number of patients, because that sometimes becomes a statistical question, but rather the behavior of the disease after 2019.
Well, I'm not too sure about this. Don't have enough information or knowledge about it. But for sure, I know one thing is during the COVID epidemic, the steroids were prescribed left, right, and center. Hmm. And this has been the experience during the COVID pandemic, after it, that those who were on the brink kind of just toppled with, because as you all know that steroids will increase your blood sugar. It is an anti-insulin hormone. Steroids are hormones, they are anti-insulin. They will break down your insulin efficiency and your blood sugars will rise. So that I know for sure that this has happened. This is one of the reason. The books, the journal papers do mention that the COVID virus itself has kind of brought out the disease, but in my practice, probably I don't see so many patients because I'm not just seeing diabetes as my practice. If how many of them are just triggered by COVID, I don't know. The other factor is the vaccine factor also, which also I have no idea. Though one will need to wait and see if more research papers come up on that.
Sir, actually, what I was trying to ask is whether the behavior of the disease has changed after whatever has happened. Which means, for example, someone who was maintaining a regular, medication, lifestyle, exercise. Now, despite of doing that, he is not able to maintain the same baseline. I mean, of course, disease also has a role to play as age advances. But
Yeah.
otherwise, does it?
I am not too sure if it has changed so drastically.
Okay. Okay. Sir, we will come to the concluding part, but just to understand before that, uh, organ specific or system specific complications of diabetes, any one organ or any one thing that you would like to emphasize on, that this is something either rather ignored or it is diagnosed too late for us to understand?
So, two things I will look into. Microvascular damage, microscopic blood vessels that are affected, that are clogged, destroyed by diabetes, are the central cause of, you can imagine if your small tiny capillaries, arterioles are blocked, all the blood supply to the vital organs is damaged. That is the beginning of a complete set of complications.
Meaning
Kidney,
brain, heart, everything.
brain, your eyes, all the tingle in the feet, the woolly feeling in your feet is because your nerves get damaged because of these microvascular damage. So microvascular damage prevention is very critical in diabetes, and that will happen if you keep your blood sugars well below 7. That should fairly be achieved.
So, sir, any take-home message for all of us? Now, first for patients, obviously,
Yes.
then for people who should not become diabetic. I always feel that, I mean, why not do something where we don't end up with a HbA1c of more than 6?
Yes. So the first and foremost is for those who have even one reading of HbA1c crossing 5.6.
Mm.
So you have got 5.8, 5.9 HbA1c. Take it seriously. Start working on your lifestyle right away. You will add several years to your life and huge quality to your life. The other is, if you're on a heavier side, I would also talk about being overweight and you have a family history of diabetes on either side. Take it as a call that obesity, overweight is a disease that you have to work with. And you know you don't sleep well, you know you are addicted to maybe alcohol, or you take, not necessarily even addicted, but you take good quantity of alcohol, or you smoke a lot, then it's time that you work on it, you prevent this illness.
Mm. Actually, now I'm getting more and more questions. Probably we'll design a separate
Yes.
list-wise podcast for that. But I believe, and do mention in the comments whether whatever you have learned so far is at least something that you will take home with you. That is the whole
Yeah,
motto
so early
of Vartala.
intervention is what I say is critical. At first detection, start making changes.
Mm.
A lot will be gained.
Thank you so much, Munjal sir, for
Thank you.
this wonderful discussion on diabetes. Not that so much of information is not there, but then
Yes.
when you present your own point of view, your own experience, it is something which is can be really useful to people. And special thanks to the Other Song Clinic. This is where Dr. Munjal practices in Mumbai. Credits to them that they let us record this podcast in their consulting cabin. Uh, if you wish to reach out to Munjal sir, I leave his website and his contact details in the description. If you have any query, you can also write to him on his email. And yes, he has got a very active social media handle on LinkedIn, on Twitter, on Instagram and YouTube, which is Similia, the classical homeopathy clinic.
Yes.
And he has got a dedicated diabetic clinic, which is Similia, the diabetes care clinic, where he treats patients holistically. So thank you, Munjal sir, for sparing time from
Thank you
your
so much. Thank you so
practice,
much.
and looking forward to having more Vartalaps with you.